Hi, everyone, and thanks for taking the time to join me on my first Manny Talks. Today, we'll be talking about predictive medicine, and I'll try to go over some questions that have been bothering me for a while in this particular space, and I'd like to get your input on this. I'm here with two buddies of mine. I have Henry over there and Alex. Say hello, folks.
Hey guys.
Hello.
So with that being said, I would like to dive into like bringing up a question that I'm sure most of us have experienced or someone has asked you. And that question is, when you go to your doctor will ask you a question such as, do you have a family history of a particular disease, right? So it's a very common question. Even when you talk to friends and you say, I have chest pain or I have cancer or whatever you have, so the first question people ask you is, do you have a family history of this particular disease? So that's something that I've been pondering about, even as a physician, right? Asking patients that, and what was the relevance of that question to any patient's particular health. Here you have a picture of my grandmother. So my grandmother grew up in a beautiful country in Central Africa known as Cameroon. She grew up in a time when women were not necessarily educated. If you know anything about Cameroon and you happen to like cigars, Cameroon does make very good cigar wrappers, and my grandmother did make good use of them. I remember sometimes hiding behind the house and watching her smoke and looking up for my mom, right? In case my mom came by. So I used to keep watch on this. So that's my grandmother. And she grew up in Cameroon, but she passed away, unfortunately, over 10 years ago in the Washington, D.C. area from hypertension, diabetes, and heart failure. So if my mom went goes to the doctor's office and they ask her, do you have a family history of hypertension or diabetes? Yes, so clearly she would say yes. If someone asked me, for example, she's my grandmother, so then I say yes. But contrast that with my mom. So that's my mother in the picture. That's her in Cameroon, actually. She's currently retired. But my mom has always been active her whole life, so she exercises. Unlike my grandmother, she was actually educated, she had a doctorate degree, and she spent most of her time growing up in the West. So my mom is retired today, but she has no diabetes or hypertension, and she still gets up and goes running. She's actually more active than I do, right? Than I am. So to her, what is the relevance of that question if she had a family history of disease? So this got me to start thinking that there's more to us, or more to what causes disease, or that is beyond our DNA or beyond our genes, right? And so for us to understand this better, I will share this great example here of what happened in China, for example. So if you look here, this graph shows you the rates of diabetes in China in 1980, which is about 0.67%. And in 2011, the incidence of diabetes had gone up to 9.7%. Over this period of time, what you notice is the DNA did not change, right? So what changed? What changed was China was getting wealthier as people got more access to cash, they started eating more junk food. And so you look at the rates of disease. So this tells you that what you eat and other factors around the environment could contribute to disease, not only genes, right? So these things are all relevant. And so another example of this, I know the last example I used was in China, but let's bring it back to the US, for example. So here we have uh, a map showing the beautiful city of St. Louis. There is a street in St. Louis, if you've been to St. Louis, Missouri, called the Delma Boulevard, right? That splits the city in the east-west distribution along racial and socioeconomic lines. In the northern part of that line, the Delma Boulevard, it's mostly African American, and people are less educated, and the incomes are lower compared to the southern part of that line, where the home values are higher, people are more educated, and mostly Caucasian. The rates of diabetes and cancer across that line are significantly higher in the northern part of that line than the southern part of that line. So this tells you about the fact that socioeconomic determinants of health actually play a significant role in disease beyond our genes, right? This is the exact same city I'm talking about here, but that difference is quite appalling, if that's the word I should use. And here, even if we look at twins, for example, even identical twins have different ways of expressing themselves, especially when they grow up, right? So you could have a twin exposed to different environmental factors, to different kinds of foods, where you could have one that could be obese, or one that is not obese, right? And this could apply, to height. There have been multiple studies around stress, for example, and the effect of stress on genes, how does it, and how, and everything else around that. So we do know around this that your genes are not something that you're doomed by, right? So just because you have a risk for a particular disease, there are multiple other factors around that are environmental, socioeconomic determinants, and other stress factors that actually determine what happens to us from a healthcare perspective. But despite knowing this, when we design clinical trials today, I would like for you to focus on this image here on the left that I got courtesy of some good friends of mine in my previous job. Slavin, thank you for this picture. But I think it shows exactly what happens in healthcare, right? So when we design clinical studies, we design it in this perfect world. That's what you see on the left here, right? Where we have perfect inclusion criteria and exclusion criteria. But when the drug gets in the market, we expect that therapy to be used in the real world. And recently, if you're all involved in this space, you've heard about this call for real world evidence clinical trials, because the payers that control access to the drug are literally saying, well, if you test that your product works in this controlled environment, but you want this product to be used in the real world setting, show me that this product works in the real world. And so, since we're all interested in digital health, for example, digital health technologies like all the sensors and wearables and other technologies that we have around us that capture data in the real world setting are very useful, right? So that's why I'm very passionate about digital health, because I think technology gives us the ability to actually capture data in this real world setting, which is something that we cannot capture otherwise in this perfect world that we design currently design clinical trials. And then if we could capture data in the real world setting and understand exactly what leads to disease, we could implement programs or put programs in place to help control that behavior, right? And if you usually show that you could control behavior and have great outcomes, then you have things such as digital therapeutics, and you heard a lot of those discussions that come about, right? So we're very interested in industry now of how we can help define, how we could use technology around that particular part of the world. So here, the slides here, I like this because it actually does a great job showing us what happens in our current healthcare system, right? So today, what we do is we practice something called reactive medicine, right? And so what happens is you develop symptoms of a disease, you get sick, and then you wait till symptoms then develop, then you get therapy, and then you hope to get better, right? What I'm advocating for in this new era of predictive medicine is that we could use all available technology today, whatever data we get from EHRs, activities, sleep data, we could have enough data from this that we can predict disease, right? Diagnose disease early and intercept or cure disease, right? Rather than wait and be reactive. Artificial intelligence and all these connected devices today could really make this, make us more proactive, and takes healthcare away from sick care, right? Where today we call people patients because they're already sick. We could get into this world where people in general look at health as a day-to-day thing. You don't have to wait till you get sick to start thinking about health. Doctors should not sit in their offices and just wait to treat sick people, right? They should take the knowledge that they have and try to educate the general population to stay healthier, because that's the way in which that's where the future healthcare can work. Because today we know how expensive healthcare is, and people are only going to live longer lives. And so if we have people living longer and sicker lives, I don't think our current healthcare system and how much money we have to pay for this is sustainable, right? So being able to intervene and predict disease is something that I aspire for, and I hope that all of you think that's the right way to go. I'm also very happy to hear your feedback, so please feel free to leave your comments below. I would definitely be responding to them once I'm done with going through this beautiful slides of mine. And here, this is I want to bring up, with this concept being in mind, I would like to bring up Susan Potter, right? So recently, in the January edition of Nature magazine, which was focused on the future of medicine, we had Susan Potter, who donated her body to science, right? And so her body was digitized. So she passed away, but medical students around the world today can study anatomy and physiology based on and Susan Potter donated her body to science. And so we all know this is fantastic. Donating body to like for dissections have been something that's happened before in the past. And many of us have are organ donors, or if you're not, maybe you should consider being an organ donor. But so that notion already exists in our world where we give away data. So what I'm advocating for is this idea of, instead of just thinking of data that you could share to help healthcare as body organs, what about the idea of donating your data, right? And what is the concept behind that? The concept is, I don't know my grandmother's entire health, like medical records, or my granddad, or my mom or my dad's entire medical history. I don't even have my own complete medical history, right? And so, if someone asked me that question that I brought up earlier, what is your family history of diabetes or hypertension? I don't know if my grandmother's diabetes or hypertension was caused by, was it genetic, or was it environmental stress factors? Was it lifestyle? Was it socioeconomic factors? I have no idea, right? And so I think that if we all do this, and we have this longitudinal history piece where we have data collected over a period of time, we could actually look at disease histories and the course of disease in a longitudinal manner. And for the very first time, we'll be able to build models that could predict disease, right? And they understand exactly what the risk factors for disease are. And so what is that concept? That concept basically boils down into creating this digital version of me, right? So I started that process a few months ago. I did get my whole genome sequenced. I just got the results literally about like a few days ago, and I'll be sharing those results going forward. But one of the key things that I found out from my results was that I had a gene that put me at higher risk for hypertension, right? And also, I was fortunate enough to be one of the few humans on Earth that can actually has a gene that I could smell asparagus from urine. I know that's a great skill to have. I didn't know that, but one of the things that my genes told me about me. But because I know today that I have a risk for hypertension, I'm seriously considering changing my lifestyle. So today we had lunch. I was trying to go for something fried, but instead I opted for a salad. I did eat salad, so you can judge me. Yes, so something healthier, right? So I try I try to do something around that. And so what am I proposing here? So I'm proposing that if all of you could join me to create digital versions of yourself, right? And you can run different simulations on yourself, right? So if you have your whole genome sequence, for example, and you know a lot more about yourself, and then you had, I'm sure a few of us have Fitbits or Garmin watches or Fitbits, whatever you have, or Apple Watch, right? For example, you track with this, or your smartphone, they track our activities and sleep activities, and then you can understand what are the best options for you, right? So for example, what if I go walking today? What if, I go running? What if I had a drink last night? What is the impact of that on my healthcare, right? What if I had some tasty fried chicken, or had a salad, or practice yoga or meditation? What does that decrease or increase my risk for disease, right? So that is an interesting way of looking at life. And I think with all the algorithms that we have today, we'll be able to predict disease ahead of time and then change our lifestyle based on what you choose to prefer, what you think is best for you, right? So to me, that's the era of predictive medicine I'm very interested in, I'm fascinated by. And I think having open access to EHR records and having open access to connected devices, and bring all our data together, we could have this world that we could actually live this longer and healthier lives based on driven by predictive medicine. I know I'm not saying anything new, but I just want to share this vision and then see what your thoughts are around this. And to add on to this, to summarize everything I'm saying is, I saw this pretty good graph that I believe illustrates exactly what I'm talking about, where when you're born, you have your gene, right? But life is a journey, right? It's not stagnant. So when you have this gene when you're born, that's your baseline piece. If you sequence yourself, for example, you understand what your risk factors are. Then you could start making the decision that you make, put you at higher or reduced risk for actually having the disease at the end of this. And so you could follow that journey of yours, right? And you could say, hey, because I am me, I know that if I eat an omelet with cheese, maybe I do something different for lunch. Maybe I have salad, for example, right? And then so to maintain my risk. But what decisions we make in life actually affects where we stand across this the spectrum, right? And I think this is a continuous process, and it's the best way, I believe, we should live life, and I think is the best way, the best value that technology brings in healthcare. And I think this is the power of artificial intelligence in healthcare to make us live longer and healthier lives. So please, I would love to hear more stories about other people that are thinking about sequencing themselves, and anyone that is open to sharing the data. We're having discussions about this as we learn. Well, I did sequence myself, but that's for me. So good for me. But what about you, right? If you don't sequence yourself, me sequencing myself on my own and collecting my data on my own brings absolutely no value if the rest of us don't build up the same database where we could learn from each other, right? So the end of one is not that great, but having more people join this movement and advocate for this kind of mindset of predictive medicine, I think we'll all live longer and healthier lives. So thank you for joining me today, and looking forward to our discussions. One more thing.